first leg or left leg. So you ready to take a look?
Yes.
Okay, you just take a look right here first, okay?
Oh, wow.
Okay, so this is the undone side right here. And here's
wow. Wow, it looks so different. Yeah.
okay.
Oh my gosh, it's amazing. Oh, wow.
Okay, and you can turn all the way facing me here. Okay. Good morning, Christina. How you doing?
Good morning, great, Dr. Sue.
Okay, so for you guys out there, we're going to do some liposuction to treat lipedema this morning. So, can you tell us a little bit about, how lipedema, how you recognized it, and how has it affected your, how has it affected you?
Well, I went to a doctor because I have some family members who have vein issues, and I'm about to turn 40, and I decided to just go in and see him, and he diagnosed lipedema, which I had never heard of before, and he said that there was no treatment, but I started looking into it, and found out that there were a lot of things I could do, diet and exercise, and I've always been really active, but I've never been able, as thin as I've ever been, I've never been able to get rid of certain places of fat on my body that are painful to the touch, and I thought that was normal until I started to hear from other women, like on a Facebook group, who have this also, and it explains why I float also in water. So we tend to float. But
can you tell people what the physical symptoms that you have are that we're talking about, where they are, how badly it affects you?
So I don't own a pair of shorts or a short dress, and it's been like my whole life I've been hiding. So that's emotionally, it's been tough. But it's really any of the places where if I have a light touch, it's very painful. It's like sometimes like a searing hot pain. Like if something touches my shins or the backs of my legs or the backs of my arms are tender. Yeah, it's been difficult. I mean, I'm happy that I found out that it's actually a disorder and it's not just something that's...
Right, definitely. And then you're telling me when you work out, your legs... feel...
They do feel...
What's the word that you use?
Heavy.
Heavy.
Really heavy.
Okay. And that's a very common thing.
Yeah, okay.
Okay. So anyways, Christine and I were talking that, we've had really good success here in treating lipedema with surgery because the majority of patients, I would say, have a very significant degree of improvement. That means like 70, 80, 90%. No one can guarantee 100% resolution out there, but this is the best thing that you can do to get rid of your lipedema symptoms. So you ready to do that today?
I am ready.
Okay, great.
Excited, thanks.
Boom. Okay, we'll come back after we do some surgery and then we'll show you her results immediately, okay? Thank you.
Thanks.
So, we're going to show you Christina's got, a really thin torso, and as you can see, I don't know if you can appreciate this, I mean, just hold your arm out like this a little bit. She's got a little bit more thickness around her arms, and stand with your arms to the side and turn for me here. She's got more heaviness right down here toward the lower part versus the upper part, which is the kind of reversal of the natural proportions. And then down here, turn facing me again. So she's got a lot of thickness around her knees. It doesn't affect too much around her calves. She doesn't have too much around her calves. But down here you can see that on her ankles, she actually has a little bulging out of the ankles. Can you turn around for us? And I think you can appreciate just a little bit here. So maybe not as heavy as, a lot of patients that we treat here, but you can go and turn around. But there's definitely some mild cuffing down the bottom, and I think the most significant thing that really identifies lipedema is not the bruising that a lot of people talk about. It's not swelling that a lot of people talk about. It really is the tenderness and heaviness and sometimes even weakness, that affect patients like Christina. So, okay, thanks, bye. Hey Christina, how you doing?
Hey, good, how are you?
Okay, so audience, we just finished her first leg or left leg, so you ready to take a look?
Yes.
Okay, you can just take a look right here first, okay?
Oh, wow.
Okay, so this is the undone side right here. See the definition, and you got the little curves right here, right?
It looks amazing.
Okay, well let's look at it standing up, okay? And let us know if you're feeling lightheaded, okay? You come on over here. And I'm gonna do some video from the back side here. Okay.
Wow, it looks so different. Yeah.
Okay, go up on your tippy toes a little bit. Okay, great. All right, you can come back down. So I'm just gonna show everybody from the front side here.
That's amazing. It's so different.
So why don't you go and just take a, start moving around a little slowly, and so that you can see all different angles.
Wow.
Then you just like, turn, so you can see your new calf shape.
Wow. That's amazing.
Does it look like a pretty calf now?
Yeah.
It's not that wedge look, right?
It's a lot better.
Okay.
That's amazing.
And then if you turn even more, look over your shoulder. Yeah, look over your shoulder right there.
Oh wow. Yeah. Oh my gosh. It's amazing. Oh wow.
Okay, and you can turn all the way facing me here. Okay. How do you like it?
It's amazing.
Yeah, I was just asking Christina if she had noticed any immediate difference, because some of our patients notice immediate differences. And what did you notice?
They were lighter when I lifted them up to get off the table. They felt a lot lighter just to move around.
Yeah. Did we unstrap some cinder blocks or bricks or something off your legs?
A couple of bricks, yeah.
Okay, but we don't, you can't really tell as far as the tenderness right now, because everything's numb and everything. So we'll find out tomorrow, and see if there's any noticeable things. But okay, so any other comments?
It was easier than I thought it would be.
Okay.
Yeah.
Okay. Awesome. You're a great patient. Thank you for coming. Thank you for watching. Bye-bye.